What are the primary pathogenic organisms that veterinary professionals must be concerned with in practice, and how do they affect animal health? Answer: the main pathogenic organisms in veterinary practice include viruses, bacteria, fungi, and parasites. Each of these can affect animals in different ways, causing a range of diseases. Viruses such as canine parvovirus, feline leukemia virus, and rabies, which can cause systemic infections or affect specific organs. Bacteria such as Salmonella, E. coli, and Brucella can cause gastrointestinal, reproductive, and systemic infections. Fungi such as dermatophytes, e.g., Microsporum spp, cause skin and hair infections, while systemic fungi like histoplasma affect internal organs. Parasites such as roundworms, fleas, and ticks cause a variety of issues, including blood loss, itching, or transmission of other pathogens. Infection control is critical in reducing the impact of these pathogens on animal populations, especially in veterinary settings. This includes practices like proper sanitation, isolation protocols, and vaccination programs. Mr. Thompson works at a veterinary clinic where he recently treated an animal showing signs of leptospirosis. After treating the animal, he noticed flu-like symptoms, including fever and muscle aches. What actions should Mr. Thompson take, and what are the guidelines for managing zoonotic diseases in the clinic? Answer: Mr. Thompson is displaying symptoms consistent with a zoonotic infection likely contracted through exposure to leptospirosis, which can be transmitted from animals to humans. The following actions should be taken. Seek medical advice immediately. Mr. Thompson should report his symptoms to his healthcare provider, as leptospirosis can lead to serious complications in humans. Follow isolation protocols. The veterinary clinic should isolate any potentially infected animals, especially those with known zoonotic risks. Report the incident. Mr. Thompson must report the potential zoonotic transmission to public health authorities as per national guidelines for managing zoonotic diseases. Implement stricter hygiene protocols. The clinic must enhance sanitation, including disinfecting surfaces, ensuring personal protective equipment (PPE) is worn, and using proper sterilization techniques. Relevant guidelines. The Centers for Disease Control and Prevention (CDC) provides protocols for managing zoonoses, including vaccination, the use of PPE, and reporting zoonotic outbreaks. What are the advantages of using PCR polymerase chain reaction in veterinary diagnostics compared to traditional methods such as culture, and in which situations is PCR the most beneficial? Answer: PCR offers several advantages over traditional diagnostic methods like culture, particularly in terms of sensitivity, speed, and specificity. PCR allows for the detection of low levels of pathogens by amplifying DNA or RNA from microorganisms, making it possible to diagnose infections even when pathogens are present in low numbers. Advantages: speed. PCR results are typically available faster than traditional culture methods, which may take several days. Sensitivity. PCR can detect very small amounts of pathogen DNA, which is useful for early diagnosis. Specificity. PCR can target specific DNA sequences, allowing for identification of a pathogen to the species or strain level. Applications. Viral infections. PCR is especially useful for detecting viruses like canine parvovirus or feline leukemia virus. Bacterial identification. In cases where bacteria do not culture easily or when rapid identification is required, e.g., Mycobacterium spp. Parasite DNA. PCR can also be used to identify parasitic DNA from fecal samples, particularly when the parasite load is low. Relevant guidelines. The World Organization for Animal Health (OI) recommends PCR as a valuable diagnostic tool for detecting notifiable animal diseases due to its high accuracy and rapid results. Explain the role of vaccination in controlling viral diseases in animals and the guidelines for administering vaccines for diseases like rabies and canine distemper. Answer: vaccination plays a key role in preventing viral diseases by stimulating an animal's immune system to produce antibodies without causing the disease. This is particularly important in controlling viral diseases such as rabies and canine distemper, both of which can have devastating effects on animal populations and pose a public health risk. Rabies. Rabies vaccination is essential for preventing transmission to humans and other animals. According to the World Health Organization (WHO), rabies vaccinations should be administered at 12 weeks of age and repeated annually or triennially depending on the vaccine used. Canine distemper. Distemper vaccinations are typically given as part of a combination vaccine for puppies at 8 weeks of age, with booster shots administered every 3 years. This is recommended by the American Veterinary Medical Association (EVMA). Relevant guidelines. Vaccination schedules should follow national veterinary guidelines, such as those outlined by the Centers for Disease Control and Prevention (CDC) and AVMA, to ensure proper immunization coverage and disease control. What are the key components of a complete blood count (CBC), and how can abnormalities in the CB be indicative of underlying diseases in animals? Answer: a complete blood count (CBC) is a diagnostic test that evaluates the quantity and quality of blood cells and provides insight into an animal's overall health. Key components include red blood cell (RBCS). Low or BC count may indicate anemia, while high counts suggest polycythemia. White blood cell (BR). Elevated WBS may indicate infection or inflammation, while low counts could suggest immunosuppression or bone marrow issues. Platelets. A low platelet count may suggest a bleeding disorder or thrombocytopenia, while high levels could indicate a clotting disorder. Abnormalities in the CBC can point to a wide range of conditions. Anemia may be caused by blood loss, hemolysis, or bone marrow diseases. Infections are often accompanied by elevated WBC counts, with specific shifts in types of white cells indicating bacterial or viral causes. Leukemia can be diagnosed with a CBC showing very high WBC counts and abnormal cell morphology. Why is fecal analysis crucial in identifying parasitic infections in animals, and how is it typically performed to ensure accurate results? Answer: fecal analysis is critical for diagnosing gastrointestinal parasitic infections, which are common in both companion and livestock animals. Parasitic eggs or larvae are often shed in feces, and identifying them can help direct appropriate treatment. Fecal examination techniques. Fecal flotation, a common method where a fecal sample is mixed with a special solution and the eggs float to the surface for examination under a microscope. Fecal smears, used for identifying protozoa such as Giardia and Coccidia. Behrman technique, used to identify lungworm larvae in fecal samples. Best practices: fecal samples should be fresh, collected directly from the animal, and handled properly to prevent degradation of parasite eggs. The American Veterinary Medical Association (AVMA) recommends examining at least 2 fecal samples taken 1-2 weeks apart to ensure comprehensive identification. When is ultrasound preferred over X-rays in veterinary diagnostics, and what are the key differences between these two diagnostic imaging techniques? Answer: ultrasound is preferred over X-rays for diagnosing soft tissue abnormalities and for real-time imaging such as assessing organ function or evaluating fluid-filled structures, e.g. cysts or abscesses. Key differences include: X-rays are ideal for visualizing bone fractures, certain tumors, and foreign objects within the body, but they are less effective for soft tissue analysis. Ultrasound provides dynamic, real-time images and is better suited for visualizing soft tissues such as the heart, liver, kidneys, and reproductive organs. Relevant guidelines. The American College of Veterinary Radiology (ACVA) provides guidance on choosing the appropriate imaging method based on the clinical scenario. What are the primary safety considerations when handling biological samples in a veterinary laboratory, and how can the risk of contamination be minimized? Answer: safety in a veterinary laboratory is paramount to protect both the technician and the integrity of the samples. Key safety considerations include personal protective equipment, PPE, gloves, lab coats, and face shields must be worn when handling biological samples. Proper sample labeling. To prevent cross-contamination, each sample must be labeled clearly and kept separate until analyzed. Disinfection. Surfaces and equipment should be disinfected between handling different samples to minimize contamination risk. Relevant guidelines. The Occupational Safety and Health Administration (OSHA) outlines standards for laboratory safety, and the World Health Organization (WHO) provides protocols for handling potentially hazardous biological samples. Ms. Ramirez works as a veterinary technician in a busy clinic. She notices that several animals have been treated for respiratory infections, and some are showing improvement while others continue to worsen. What should Ms. Ramirez do to improve infection control and ensure proper containment of the disease in the clinic? Answer: Ms. Ramirez should immediately implement enhanced infection control protocols. This includes: quarantine the animals with respiratory symptoms to prevent cross-contamination. Review cleaning procedures to ensure that all high-touch surfaces, kennels, and equipment are sanitized frequently. Staff education on proper PPE use and hygiene to prevent the spread of infection. Consult with the veterinarian to determine if there is a more contagious pathogen involved, and consider testing the animals for additional pathogens. Relevant guidelines. The Centers for Disease Control and Prevention (CDC) infection control guidelines for veterinary clinics recommend strict isolation procedures and sanitation protocols to minimize the spread of infectious diseases. How do vaccination protocols contribute to the control of infectious diseases in animal populations, and what are the key considerations when designing these protocols? Answer: vaccination protocols help reduce the incidence and spread of infectious diseases by ensuring animals are protected against common pathogens. Key considerations when designing vaccination protocols include age of the animal. Vaccinations should be administered according to age-based schedules, e.g., puppies receive their first distemper vaccine at 8 weeks. Disease prevalence. In areas with high incidences of certain diseases, more frequent boosters may be necessary. Types of vaccines. Some vaccines are core, e.g., rabies, distemper, while others are non-core, depending on the risk factors in the area. Relevant guidelines. Veterinary vaccination schedules should follow national or international guidelines, such as those from the American Animal Hospital Association, AHA, or World Health Organization, WHO, to ensure they are effective and appropriate for the specific region or animal group. Explain the life cycle of the common roundworm, Toxocara canis, in dogs, and discuss how understanding its life cycle is essential for treatment and prevention. Answer: the life cycle of Toxocara canis in dogs involves several stages. Eggs are passed in the feces of an infected dog. These eggs are infective after 2 to 4 weeks in the environment. When a dog ingests the infective egg, the larvae hatch in the intestine and penetrate the intestinal wall. They can then migrate through the bloodstream to various organs, including the liver and lungs. Once in the lungs, the larvae move up the trachea, are swallowed and mature in the small intestine, where they begin laying eggs. Transmission to puppies can occur transplacentally or through lactation. Adult dogs may also serve as intermediate hosts when they ingest infected rodents or other prey. Understanding the life cycle is essential for prevention because it helps in selecting the correct deworming regimen. Preventive treatments such as routine deworming and controlling environmental contamination help reduce the incidence of infection. It also aids in preventing zoonotic transmission to humans, especially children, who can accidentally ingest eggs from contaminated soil or surfaces. What are the primary safety considerations when performing radiographic imaging on animals, and how do these considerations differ between species such as dogs, cats, and large animals like horses? Answer: the primary safety considerations when performing radiographic imaging include radiation protection, personnel protection, use lead aprons, thyroid collars, and gloves. Ensure that all personnel are outside the primary beam during exposure. Lead barriers or walls. Ensure the room is equipped with lead-lined walls to absorb radiation. Patient protection. Use lead shields to cover parts of the animal not being imaged. Positioning and restraint. Use proper positioning aids such as sandbags or positioning devices to prevent the animal from moving during the exposure. Species differences. For small animals like dogs and cats, sedation or anesthesia may be required for optimal positioning and to prevent movement. For large animals such as horses, physical restraint by handlers and sometimes sedation are necessary due to their size and strength. The use of a cassette holder and fixed radiographic machine is often employed to ensure safety. Proper exposure settings. Depending on the species, the required exposure settings, kVp and mass, will differ. For example, larger animals like horses will require higher exposure settings than small animals like cats due to the density of their tissues. Safety procedures vary by species, with larger animals requiring more substantial physical restraint and specialized equipment to ensure both accurate imaging and safety for both the animal and the technician. Mr. Harris, a veterinary technician, is tasked with performing an ultrasound on a 5-year-old German Shepherd suspected of having a bladder stone. Mr. Harris is not sure whether the animal is adequately sedated, as the dog appears slightly agitated but not fully immobile. What steps should Mr. Harris take to ensure the procedure is safe and effective? Answer: Mr. Harris should take the following steps to ensure safety and accuracy. Assess the sedation. It is crucial that the dog remains as still as possible during the ultrasound to get clear images. Mr. Harris should immediately consult with the attending veterinarian to ensure that the sedation level is adequate. If necessary, an additional sedative may be administered. Restraint. If sedation is not an option, or if the dog's reaction to sedation is not ideal, Mr. Harris should use physical restraint, ensuring it does not cause undue stress to the animal. He should use soft restraints or positioning aids to minimize movement without harming the dog. Ultrasound preparation. Mr. Harris should apply a generous amount of gel to the abdominal area and ensure the ultrasound probe is in direct contact with the skin to avoid air gaps that could affect image quality. Proper monitoring. During the procedure, Mr. Harris should continuously monitor the animal for signs of discomfort or distress. If the dog becomes agitated, the procedure may need to be paused or sedation adjusted to ensure both patient and technician safety. Discuss the role of zoonotic diseases in veterinary medicine and explain why certain parasitic infections in animals pose a significant risk to humans. Answer: zoonotic diseases are infections that can be transmitted between animals and humans. Many parasitic infections, such as those caused by Toxocara, Echinococcus, and Giardia, are of significant concern in veterinary practice due to the potential for human transmission. Toxocara roundworm. The larvae of Toxocara species can migrate in humans, causing visceral or ocular larva migrans. This disease is most common in children who ingest infective eggs from contaminated soil, but it can also affect adults in rare cases. Echinococcus hydatid disease. Infected canids, dogs or foxes, excrete Echinococcus eggs in their feces. Humans, typically farmers or those in close contact with animals, can accidentally ingest the eggs, leading to cyst formation in internal organs. Giardia. This protozoan parasite can be transmitted through contaminated water or direct contact with infected animals. It causes gastrointestinal illness in both humans and animals. While zoonotic infections pose a risk, humans often interact closely with animals, especially pets, livestock, and working animals. Poor hygiene, such as not washing cans after handling animals or cleaning up feces, can lead to the transmission of parasitic eggs or cysts. Veterinarians and technicians must be aware of these risks to prevent cross-species transmission, especially when handling animals that may carry zoonotic parasites. What are the principles and applications of contrast radiography in veterinary radiology, and what are the differences between positive and negative contrast agents? Answer: contrast radiography is used in veterinary medicine to enhance the visibility of internal structures and organs in radiographic images. Contrast agents are substances that alter the way X-rays pass through the body, providing better differentiation between various tissues. There are two main types of contrast agents used. Positive contrast agents. These are substances that appear white or radiopaque on a radiograph as they absorb more X-rays. Common positive contrast agents include barium sulfate, used for gastrointestinal studies, particularly in the esophagus, stomach, and intestines. Iodine-based compounds, used for contrast in vascular structures, the urinary system, and certain body cavities. Positive contrast agents are used in cases where specific organs or structures need to be outlined clearly against surrounding tissues. Negative contrast agents. These agents appear dark or radiolucent on radiographs as they do not absorb X-rays but allow them to pass through more freely. Common negative contrast agents include air gas, often used in the gastrointestinal tract or bladder when evaluating for air-filled cavities or pneumocystography evaluation of the bladder. Carbon dioxide can be used in similar applications where minimal interference with the radiograph is desired. Principles: the choice between positive and negative contrast depends on the area of interest and the type of structure being studied. For example, barium sulfate is ideal for visualizing the gastrointestinal tract, while iodine compounds are often used in angiography to visualize blood vessels. Conversely, air can be used to expand body cavities for better visualization of organs that are otherwise difficult to view. The correct application of contrast agents is crucial for the accurate interpretation of radiographs and proper diagnosis. What are the safety guidelines for handling radioactive materials in a veterinary clinic, particularly in relation to nuclear medicine procedures? Answer: handling radioactive materials in a veterinary clinic requires strict adherence to safety protocols to protect both veterinary staff and patients. Key safety guidelines include use of personal protective equipment, PPE. Staff should wear lead aprons, thyroid shields, gloves, and dosimeters to monitor exposure to radiation. Radiation safety protocols. All procedures involving radioactive substances should be performed in dedicated, controlled areas that are clearly marked with radiation hazard signs. Only authorized personnel should be allowed access to areas where radioactive materials are used or stored. Minimize exposure. Radiation exposure should be minimized by maintaining distance from radioactive sources, using shielding materials, e.g., lead walls or barriers, and limiting the time spent in close proximity to the radiation source. Disposal of radioactive waste. Radioactive waste, such as contaminated materials, should be disposed of according to local regulations, typically through designated waste disposal services that handle radioactive materials. Patient care. After procedures involving radioactive materials, pets should be monitored for any potential side effects, and clients should be instructed on how to safely handle their animals during the post-procedure period to minimize radiation exposure to the family. Describe the key diagnostic techniques used for identifying parasitic infections in animals, including both external and internal parasites. Answer: diagnostic techniques for parasitic infections in animals vary depending on whether the parasite is external or internal. Key techniques include external parasite diagnosis, flea combing. A fine-toothed comb is used to comb through the animal's coat, catching fleas and flea feces, which can be examined under a microscope. Skin scrapings. A scalpel blade is used to scrape a layer of skin to collect debris and possible mites, e.g. Demodex or sarcots. This sample is then examined under a microscope. Wood's lamp examination, used for detecting fungal infections such as ringworm, which fluoresce under the UV light. Internal parasite diagnosis, fecal flotation. A stool sample is mixed with a flotation solution that causes parasite eggs, e.g. roundworms, hookworms, to float to the surface where they can be examined under a microscope. Fecal sedimentation, used to detect heavier eggs such as those from Echinococcus. PCR, polymerase chain reaction, a molecular diagnostic test that can detect the DNA of specific parasitic organisms, allowing for the identification of protozoan parasites like Giardia or Cryptosporidium. Blood tests, used to identify parasitic infections in the bloodstream such as Babesia or Ehrlichia through serology or PCR testing. These techniques provide veterinarians with the necessary tools to identify and treat parasitic infections effectively. Explain the importance of radiographic positioning in veterinary radiology and how incorrect positioning can lead to diagnostic errors. Answer: radiographic positioning is crucial in veterinary radiology to ensure accurate and diagnostic quality images. Incorrect positioning can lead to distortion. If the animal is not positioned correctly, the image may become distorted, making it difficult to assess structures accurately. For example, if the limbs are not properly aligned, fractures might be missed. Obscured structures. Incorrect positioning can cause overlapping of structures, such as the heart and lungs in thoracic radiographs, which may obscure important details. Inaccurate measurement. Proper positioning is essential for accurate measurements in diagnostic imaging, particularly in orthopedics. Misalignment can lead to incorrect diagnosis of fractures or joint dislocations. Correct positioning techniques vary depending on the species and the specific area being imaged. Common views include lateral ventrodorsal (VD) and dorsoventral (DV) and must be adjusted based on animal size and anatomy. What is the role of ultrasound in diagnosing abdominal diseases in small animals, and how does it compare to traditional radiography? Answer: ultrasound is a non-invasive diagnostic tool that provides real-time, detailed images of soft tissues, making it highly useful for diagnosing abdominal diseases in small animals. Key advantages include real-time imaging. Unlike radiographs, ultrasound allows the veterinary technician to observe the organ in motion, e.g. peristalsis of the intestines, blood flow, which can aid in the diagnosis of conditions such as tumors, abscesses, and fluid accumulation. Soft tissue differentiation. Ultrasound excels at visualizing soft tissues like the liver, kidneys, and bladder, while radiography is better suited for imaging bone structures. Ultrasound can detect abnormalities like masses, cysts, or organ enlargement that may not be visible on radiographs. Guidance for procedures. Ultrasound can also be used to guide needle biopsies, fluid aspiration, and catheter placement, providing greater accuracy than radiography. While radiography remains essential for visualizing bones, gas-filled structures, and certain types of lesions, ultrasound is invaluable for evaluating soft tissues, detecting fluid, and guiding surgical procedures. Discuss the principles behind the use of CT and MRI in veterinary medicine, particularly in diagnosing neurological conditions. Answer: CT computed tomography and MRI magnetic resonance imaging are advanced imaging techniques used to diagnose neurological conditions in veterinary medicine. Key principles include CT principle. CT uses X-ray beams and a computer to create detailed cross-sectional images of the body. It is highly effective for visualizing bony structures and can detect hemorrhages, skull fractures, and tumors in the brain. Application: CT is particularly useful for detecting traumatic brain injuries, brain hemorrhages, and conditions involving calcified tissues or bone fractures. MRI principle. MRI uses strong magnetic fields and radio waves to produce highly detailed images of soft tissues. Unlike CT, it does not involve radiation. Application: MRI is superior for imaging soft tissues like the brain and spinal cord. It is particularly valuable for diagnosing neurological conditions such as brain tumors, spinal cord injuries, intervertebral disc disease, and brain infections. Explain the key differences in the circulatory system of reptiles and mammals and how these differences impact the care of these animals in a veterinary setting. Answer: the circulatory system of reptiles and mammals differs primarily in the structure of the heart and the flow of blood. Mammals have a four-chambered heart which separates oxygenated and deoxygenated blood, ensuring efficient circulation to various parts of the body. In contrast, reptiles typically have a three-chambered heart with partial separation of oxygenated and deoxygenated blood. However, certain reptiles, like crocodiles, possess a four-chambered heart similar to mammals. In practical terms, the heart structure of reptiles means that they are more susceptible to cardiac issues if there is inadequate thermal regulation. Reptiles are ectothermic, relying on external temperatures to regulate their body heat, so failure to maintain proper environmental temperatures can lead to heart strain or other circulatory problems. Veterinarians should carefully monitor temperature and avoid drastic changes in their habitat, as sudden shifts can induce stress, leading to circulatory issues. What are the most common symptoms of metabolic bone disease (MBD) in reptiles, and what treatment options are recommended to manage this condition? Answer: Metabolic bone disease (MBD) in reptiles is primarily caused by calcium deficiency, inadequate UVB lighting, or poor dietary habits. Symptoms include softening of the bones, especially the jaw, lethargy, muscle tremors, inability to move properly, and in severe cases, paralysis. Treatment involves calcium and vitamin D supplementation. Calcium is often given through injections or oral supplementation. Vitamin D is crucial for calcium absorption, especially in reptiles kept indoors without UVB lighting. UVB light exposure. Reptiles require UVB light to synthesize vitamin D naturally. Veterinary care includes ensuring reptiles are exposed to proper UVB light or providing supplementation. Dietary adjustments. Offering a balanced diet rich in calcium, such as leafy greens and appropriate invertebrates, is key to long-term management. Veterinary professionals must also educate owners on the importance of UVB lighting and proper supplementation to prevent MBD in the future. Discuss the ethical considerations when using primates in laboratory research and how they should be managed to ensure compliance with regulations like the NIH guidelines and AAALAC accreditation. Answer: When using primates in laboratory research, ethical considerations center around minimizing suffering and ensuring that the research is justified by significant potential benefits. Primates are highly intelligent animals with complex emotional and social needs, so their use in research must be rigorously justified. Key ethical principles include the 3Rs: replace, reduce, and refine. Researchers must aim to replace primates with less sentient species whenever possible, reduce the number of animals used, and refine experimental methods to minimize suffering. Environmental enrichment. Primates should be provided with an environment that allows them to exhibit natural behaviors such as social interactions and exploration. This is essential for both their physical and mental well-being. Regular veterinary care. Primates in research settings require ongoing health assessments to monitor any signs of stress or physical problems. Disease prevention, such as vaccinations and parasite control, is crucial. Compliance with guidelines. The NIH and AAALAC set regulatory standards for laboratory animal care, ensuring that research institutions provide adequate housing, care, and social enrichment. What is the role of protein in the diet of birds of prey, and how should it be balanced with other nutrients to ensure proper health? Answer: Protein is a critical component of the diet for birds of prey as it supports muscle development, feather growth, and overall health. Birds of prey, being obligate carnivores, rely heavily on protein, which they obtain from consuming whole prey such as rodents, birds, and small reptiles. However, protein should be balanced with other nutrients, particularly fat and calcium. An imbalance, particularly an excess of protein without sufficient fat, can lead to kidney damage and other metabolic issues. Additionally, a lack of calcium can result in bone fractures, as birds of prey have high calcium demands, especially for females during the breeding season. In terms of dietary balance, fat provides essential fatty acids and supports the absorption of fat-soluble vitamins. Calcium, required for bone health and the formation of eggshells in females, vitamins, and minerals. A varied diet that includes whole prey ensures that the bird receives a broad range of nutrients, but supplementation may be necessary if whole prey is not available. Mr. Thompson is the owner of a pair of African grey parrots, and he is considering breeding them. However, he is unsure about the steps he should take to ensure their reproductive health and the safety of the chicks. What recommendations should you provide to Mr. Thompson in this situation? Answer: When advising Mr. Thompson, several key factors should be considered to ensure the reproductive health of the African grey parrots and the safety of the chicks. Environmental setup. Parrots require a suitable environment for breeding, including a spacious cage, nesting boxes, and a quiet, stress-free atmosphere. The nesting box should be placed in a secure and private area to avoid disturbance. Dietary needs during breeding. Female parrots require increased calcium intake for egg production. The high-quality diet with adequate protein, vitamins, and minerals is essential. Special attention should be paid to calcium supplementation to prevent conditions like egg binding. Health screening before breeding. Both parrots should undergo a veterinary examination to check for any health conditions that could affect reproduction or the health of the chicks. Testing for infectious diseases like psittacosis or avian-borne virus is recommended. Breeding cycle monitoring. Monitoring the female parrot for signs of egg laying is crucial. After laying eggs, it's important to monitor the female for any signs of egg binding or other complications. Chick cat. Once the eggs hatch, the chicks will require special attention. Mr. Thompson should monitor the parents to ensure they are caring for the chicks appropriately. What are the main strategies for disease management in laboratory rodents, and how do these strategies contribute to both animal welfare and the integrity of research results? Answer: disease management in laboratory rodents focuses on preventing the introduction of pathogens, maintaining a healthy environment, and promptly addressing any health concerns. Effective strategies include quarantine and health screening. New animals should be quarantined for a period to monitor for any signs of disease. Regular health screenings, e.g., blood tests, microbiological culture, ensure that animals are free from pathogens that could affect research integrity. Sanitation and hygiene. Maintaining a clean environment is critical to preventing the spread of infectious diseases. Regular cleaning and disinfection of cages and equipment, along with proper waste disposal, help minimize the risk of contamination. Vaccination and prophylactic treatments. Some rodent species are vaccinated against common diseases. In addition, veterinarians may administer preventive treatments such as deworming or prophylactic antibiotics depending on the needs of the colony. Monitoring and early detection. Regular health checks and observation are essential to detect any signs of illness early. Early intervention helps prevent outbreaks and ensures that animals remain in good health, thus maintaining the validity of experimental results. What are the legal requirements for keeping a venomous snake as an exotic pet in most countries, and what steps must be taken to ensure compliance with regulations? Answer: in most countries, the ownership of venomous snakes is strictly regulated due to the potential danger to humans and other animals. Legal requirements typically include licensing and permits. Many jurisdictions require owners to obtain specific permits to keep venomous snakes. This process often involves demonstrating proficiency in handling such animals, along with an understanding of their needs and the risks involved. A cage and containment. Venomous snakes must be housed in secure, escape-proof enclosures that meet certain standards for size and safety. The enclosures should be designed to prevent accidental human contact while allowing the snake to express its natural behaviors. Training and education. Owners may be required to undergo training to ensure they can handle venomous snakes safely. This training might include emergency response procedures in case of a bite and proper handling techniques. Veterinary care. Regular veterinary checkups are essential to monitor the health of venomous snakes, including parasite control and disease management. Veterinarians must be experienced in treating venomous species to ensure proper medical care. Describe the appropriate handling techniques for a small mammal such as a guinea pig and explain the reasons behind these techniques. Answer: guinea pigs are sensitive animals that can become easily stressed by improper handling. The appropriate techniques for handling guinea pigs are: support the body properly. Always support both the chest and hindquarters of the guinea pig. This prevents stress on their spine and provides a sense of security. Avoid sudden movements. Guinea pigs are prey animals and can startle easily. Sudden movements can cause stress and injury. Minimize handling time. Guinea pigs should not be handled for long periods, as excessive handling can cause them stress. Short, calm sessions are ideal to help them feel comfortable. Use calm and gentle interactions. Approach guinea pigs quietly and gently, allowing them time to adjust to your presence. Loud noises and rough handling can trigger fear and stress, potentially leading to health issues. These techniques aim to reduce stress and ensure the animal's safety during handling, which is crucial for maintaining their physical and mental health. What are the key differences between using rodents and rabbits in laboratory research, and what factors should researchers consider when choosing between them? Answer: rodents and rabbits differ significantly in their physiology and behavior, making each more suitable for different types of research. Size and metabolism. Rodents are small and have a higher metabolic rate compared to rabbits. This affects the dosing of drugs and the rate of biological processes, making rodents more suitable for studies involving pharmacology or toxicology. Social behavior. Rodents are often housed in groups, which is essential for their well-being. Rabbits, on the other hand, are more solitary and may require individual housing prevent stress and aggression. Reproductive characteristics. Rabbits breed at a faster rate than rodents and have larger litters, making them suitable for research in reproductive health and genetics. When choosing between rodents and rabbits, researchers should consider the nature of the study, the required lifespan, and the specific physiological needs of the animals involved. How should veterinarians approach the prevention and management of parasitic infections in exotic reptiles, and what are the key challenges in treating such infections? Answer: parasitic infections in exotic reptiles can be difficult to diagnose and treat due to the wide variety of parasites and the challenge of recognizing early symptoms. Key management strategies include routine fecal exams. Regular fecal exams are critical for detecting parasites like internal worms and protozoa in reptiles. Since reptiles may not show symptoms until the infection is severe, fecal exams should be a part of routine health assessments. Environmental control. Maintaining a clean and hygienic habitat is essential in preventing the spread of parasites. This includes regular cleaning of enclosures and offering appropriate substrate to avoid contamination. Targeted treatment. The treatment for parasitic infections in reptiles often involves antiparasitic medications. The choice of medication depends on the type of parasite identified, and veterinarians must choose drugs that are safe for the species being treated. Monitoring. Reptiles should be monitored post-treatment to ensure that the infection has been fully eradicated and that no further health issues arise from the parasite or the treatment itself.